Hi, this is Andrea for HIT 210, Chapter 13. Are you ready for CPT-4 coding? I bet you're ready to wave a fond farewell to ICD-10-CM coding for a while and try something different. If you did really well at ICD-10-CM coding, you may find CPT-4 to be challenging. However, if you found ICD-10-CM to be challenging, you may find that CPT-4 coding is something you enjoy, and this is good. So they're just very different classification systems. And it's a way for you to learn about both because you'll need both in the settings that you're going into, at least to understand the basics and know where to go if you need to find information. So here are my teaching notes. I'm just going to go through them with you, and then we will pull up the AHIMA encoder software, and I'll show you how to work through that. So here we go. We're going to cover organization, reporting time and place, add-on codes, modifiers, unlisted procedures and services, category 2 and 3 codes, coding ethically, because that is very important, and basic coding guidelines. And all of this content is CPT-4. So what you have learned about ICD-10-CM, you need to set aside because it's totally different. So draw a line in your mind, and on one side of your mind is ICD-10-CM, then there is a tall, tall, tall cement wall, and then on the other side, you're going to start filling your mind with CPT. Here we go. The sections of the CPT book, whether you're talking a physical paper book, which I happen to have at home, which is wonderful to use. I prefer paper books, but then again, that's how I was trained. Back in the olden days, before there were electronic coding reference materials, we could only use books. And so that's where my comfort level is going through a book. But I've had to learn over the years, when everything became computerized, how to work in the electronic world. For you, you may find that you never see an actual paper book. You may see that you only have online electronic resources, and that's what I've tried to do with introducing you to the CDC website and now to the AHIMA encoder, is to help you do it electronically. But if you find yourself a book person, you like flipping through the pages, you like looking at it, it makes a lot of sense to go ahead and do that. So sections that you're going to run into. First one is evaluation and management codes, E&M codes. They're the sequence of 99201 through 99400. As you look over here, do you see something interesting? Yes. What you see is that these are 5-digit codes, right? When you were in ICD-10-CM, it was 3 to 7. CPT codes are always 5-digit, and they are, for the most part, numerical. So you're not dealing with A's and Z's and U's and I's and D's and Z's and X's and all sorts of other things. You're pretty much, for the most part, going to deal with 5-digit numbers. So that first section, evaluation and management, this is what you use for coding provider activities. For instance, if you have a provider who sees patients in the hospital, a provider who sees patients in the office, a provider who sees patients at a nursing home, all those types of codes, a provider who does telehealth, that's all going to be under the E&M codes in that 99201 through 99400 section. The next one is an itty bitty section for anesthesiology. And you'll notice, if you're looking at my board, I'm circling with, if you're looking at your screen, I'm circling with my mouse. There are anesthesia codes in the 00100 through 01999 and notice this, 99100 through 99140. So there's a handful of codes in a separate spot. So you just want to be aware that anesthesiology, pathology and lab, and medicine are the ones that have breaks in them. Okay, so you may find yourself noticing that. Next section is surgery, and that is one of the biggest sections in the CPT book because there are so many procedures that are performed on an outpatient basis. And that's going to be 121 through 69990. You can see that's going to be a huge section that we're going to be working with. The next one is radiology. That's going to include nuclear medicine and diagnostic ultrasound. That's what those stand for. That's in the 70010 through 79999 code set. Then we get into pathology and lab, all those tests that have to be run and done and reviewed and posted. They start in the 8000 codes, 80047 through 89398. And then there's also a handful of them. Look here, 0001U to 0138U. So again, there's a break there. You just want to be aware of it. Medicine is the last section, and that tells you what's going on medically that's being done for the patient. And that starts in the 9000s again. And there is a break, you'll notice there. So you've got those E&M and medicine are going to be your 9000s. Anesthesiology is your zeros. Surgery is 1 through 6. Radiology is 7000s, and 8000s are lab. So it just kind of helps you to know the structure because it'll help you know where in the book to go. But again, there's an index in here. What's interesting is the index is in the back of the book. It's not the front. You know, when we were doing ICD-10-CM coding, we went to the index first. You can still go to the index in CPT-4, but it's going to be in the back of the book. You might be better off, you might find yourself being better off if you just go to the section and start working through. The index is good, especially if you're looking for something surgery related though. Then you have Category 2 codes. There's a whole section on those, and we'll talk about those in a little bit. Category 3 codes, there's a section on those. And then there are plenty of appendices. Appendice A through Appendice P. Lots and lots. You'll want to familiarize yourself with them. You don't need to memorize them. However, the appendix that you will look at the most is Appendix A, modifiers. And we're going to talk about modifiers in a little while. But just make sure that you know that there are these appendices and in general what they could kind of cover, and that Appendix A is modifiers. That will help you tremendously. And then the last section of the book, as I said, is the index. So you've got the index here that you can go to, and then you'll go back to your sections. All right, so moving on. All right, reporting time and place of service facility. With coding CPT-4, sometimes you are required to report time and place of the service or the type of facility that the service is provided in. And this is something you'll need to know. It'll be in the section that you're working in, but you just, again, it's just background knowledge that you need to have. So, okay, if there are specific guidelines regarding time, follow them. If they tell you within 30 minutes or within 60 minutes, or if it's been 31 minutes, round up to 60 minutes, those are things you need to follow. In general, and this is right from the CPT book from 2020, time is the face-to-face time with the patient. It is not the time that the patient was in the office. It is the time that they were face-to-face with the provider was with the patient. So make sure you understand what their definition of time is. It's the provider's face-to-face time with the patient. Okay, so a unit of time is attained when the midpoint is passed. This is another rule. This is the one I was just talking about. If your unit of time is 30 minutes, at 16 minutes, you can use that full 30 minutes. Another example would be if your unit of time is 1 hour and the patient and provider have been together face-to-face for 31 minutes, and that's what's documented by the provider, then you can go ahead and use that 1 hour. If it's under 31 minutes, then you can't use that full unit of time. So you just want to do that. Okay, be careful because some codes are tied to a particular setting or location of service. Some codes are for ambulatory surgery centers. Those are independent outpatient centers. They are not part of a hospital, freestanding ED facilities that are not attached to a hospital or owned by a hospital, those types of things, that's a different setting. Time in a nursing home may be different than time in an office. So you've got to just be aware of your setting. Office time may be different than clinic time or surgery time. So again, you've got those things to be considered. Time with a patient in an inpatient setting that is not an ICU is different than time spent with a patient in a hospital ICU. So you need to know your setting. You need your provider to make sure it's clear what your setting is. All right, now the other thing is you need to know the difference between facility versus professional coding / billing / charges and when to use both. Facility is typically used for everything except what the professional is doing. The professional billing charging is for that provider, for their services, for what they're doing. And the facility is for everything else beyond that. Or it means that if it's hospital based, the professional is the provider that provides the services, and the facility could be for the techs if you're talking radiology or something else like that. So just there's a difference there. Or for an observation, facility charges are like the bed charges if you're an observation patient. So be aware of those types of things. I think at this point we've been talking almost 12 minutes, or I have. So I'm going to go ahead and stop the video here. This will be the end of part 1, and I will come back and we will do part 2. So hang in there.